Good morning.
Good morning.
How are you?
Good. How are you?
I'm good. Well, thanks for being my February person.
Absolutely.
Sorry, we've been like playing schedule tag.
I
So
know. I know. It worked out. We rescheduled. I ended up having stomach virus and kids were sick last week, so it all worked out.
yeah, and then weather, but hey, it's still February, so it still counts, right?
Yes.
Good. Well, I'm just going to jump right in and we'll start with, kind of just telling me or everyone that's watching who you are and what you do just to get us started.
Sure. Yeah. So my name is Jenny McSherry, and I'm a physical therapist. And I've been physical therapist for almost 14 years now. So it's crazy. Feels like I just graduated, but yeah.
Hang on to that.
No, I know.
So tell me what inspired the creation of Fort Mill Neuro Balance and kind of what makes your approach to neurological imbalance therapy different.
Yeah, so I had been working as a physical therapist in the inpatient rehab hospital setting for about 10 years. I worked primarily with patients who had suffered from a neurological condition such as a stroke, brain injury, Parkinson's disease, things like that. I've always had a passion for neurological rehab. Even back in PT school, I really loved my neuro classes. I was really drawn to that. And I also had always had a dream of starting my own business. So about 10 years in, I just felt like the urge, okay, this is the time, I'm going to do it. So then I had to decide what kind of business was I going to do. And I really felt, talking to clients in the hospital, I felt like there was really a need for more specialized neuro rehab in people's homes. I felt like when they were discharging home, there just wasn't a lot of access. There's, some therapy they can get, but I felt like it wasn't enough, and a lot of, a lot of it wasn't specialized to the neurological population in particular.
Right.
So that's kind of where I decided to go with that route.
So, how do you tailor the therapy programs to meet specific needs of the seniors?
So at each visit, I go in, I do a full 60 to 90-minute assessment, full body strength testing, balance testing. We perform different tests and measures to determine exactly their deficits. And then based on these results, in addition to any goals the client might have, we'll come up with a specialized treatment program to meet their individual needs.
That's really good. I know that's important. So many, it's just kind of go in and go through the motions in some places. So it's great that they can have like a more targeted goal and outlook to work on. So there are
Mm-hmm.
certain warning signs family members or caregivers should watch for that are indicating that they might need balance or neurological therapy.
I would say, anyone who has had a neurological diagnosis, such as a stroke or brain injury, Parkinson's disease, multiple sclerosis, or any other neurological diagnosis, they would all benefit from neurological physical therapy. All of these are lifelong conditions, and they benefit from long-term physical therapy services. The problem is our typical insurance-based physical therapy companies are typically not able to provide lifelong therapy. So that's kind of where my business comes into play. I'm a concierge service, and so I
Mhm.
am able to, I don't have any restrictions from insurance companies. I am able to see my clients long term for that lifelong therapy that they might need, which is a great benefit of my service.
Yeah.
Would be like anyone who's finding themselves just having difficulty getting in and out of a chair or on and off the toilet. If you're feeling unsteady or you're having falls in the home, those would also be indications of someone who would benefit from some balance therapy that I could help with as well.
Do you find that a lot of times people use you to kind of supplement? So they've been doing therapy and now what the insurance has said they need, you kind of step in at the other side of that and pick up where they left off?
Absolutely. Yeah. So I always encourage my clients, if they have, their benefits through their Medicare or other private insurance, go ahead and use those. of course, they're only going to last so long, so I can kind of pick up where they left off with their insurance-based therapy and provide more of a wellness maintenance program to keep them going. I know sometimes it's hard to stay motivated with your therapy doing it on a regular basis, so I can kind of come in. Some of my clients I see once a week, maybe once a month, just to kind of keep them on their program. I have a new client I'm seeing next week. He just had a stroke, and he is going to be doing 2 days a week with his insurance-based therapy, and then I'm going to jump in and do another 2 days a week with me. So he's getting 4 days of therapy coming out of his inpatient rehab stay, which will be crucial. You know, those first couple months after having a stroke, it's really important to get that intensity. So it's going to be, I think, great for him to have those 4 days of therapy a week right
Yeah,
away.
that's great. I mean, a lot of times when we go in and do nurse assessments, you know, they come out of it knowing, okay, well, they have therapy come, you know, 1 or 2 days a week, but they need to be doing stuff at home.
Yeah.
And our caregivers sometimes struggle just to, you know, hey, we need to do your therapy today. And so it's always nice to have that backup, like, hey, you know, you can bring Jenny in and have her, you know, get them motivated to do a little bit more.
Yeah, absolutely. Another indication would be, you know, maybe your insurance company just is covering outpatient therapy for you. They're like, well, you're not homebound, so you don't really technically qualify for home health therapy. But this client is like, you know what? I just can't get out. I can't get to the gym. I can't get to outpatient therapy. It's just not going to work for me. Or I'm just maybe just kind of lazy and don't want to go. Like
Uh,
their caregiver might say, "Hey, let's just hire someone privately and just bring me into their home." It just makes it a lot more accessible, and people are more
mhm.
likely to do it. I think if you're just coming to right in their front door and having them do the therapy, so that's a nice benefit too.
Yeah, I mean, it's easy to look for the excuses that
Yeah,
they're easily found to say, oh, I can't go. Yeah.
yeah,
And we do have a lot of people that, you know, they struggle to get to appointments regardless of what it is. So it's
right,
great that you come to them and bring everything with you.
yeah.
So as a, you know, you've partnered with Visiting Angels. How
Mhm.
do you feel like that's helped bridge the gap between kind of in-home care and therapy services for seniors?
Yeah, so partnering with Visiting Angels has been great. I feel like we can both be assessing the clients and working to see how they would benefit from additional services to be safer at home. For
Mhm.
example, if I'm doing therapy with a client and I notice they're consistently forgetting to take their medications, or they're not safe taking a shower or getting dressed, maybe they need some help with meal prep or running errands, things like that. I immediately have a resource like Visiting Angels that I can refer them to and help them with these tasks. In return, I feel like Visiting Angels.
Yeah, absolutely. So you're also a part of our Gracefully Aging Network, which is kind of a local cluster of different senior vendors. How do you think that collaboration with other senior focused professionals has been helpful for providing a more comprehensive approach to care?
I feel like I've just gained a lot of knowledge. Like I feel like I didn't have a lot of resources before. If people would ask me questions, I need some help with some home organization, or I need help with getting some rails installed in my bathroom, or I need help with, transportation, some medical equipment. There's Our group is filled with such a variety of different people. I feel like any question now that people ask me, I'm like, oh, I've got a resource for that. I feel like I'm just more helpful and able to provide them and direct them to a resource immediately. And I know that the people in our group are all great. So it's just been a great resource to have.
Yeah, I think for me on that side of it, it's been getting to know people individually, you know,
Hmm.
having one-on-ones with each of them, like lunch with you, and just really understanding, you know, where their heart is, because it's so important to make sure that, you know, everybody, it's a business at the end of the day, but most importantly, it's making sure that the seniors get the help they need. And
Hmm.
so just knowing that somebody genuinely wants to see that
Yeah.
is really important. And I know everybody in our group is that way. It's just really great to have such a solid set of resources to give out when you need to.
Yes.
So, because we do have caregivers going out, what kind of role do they play in maintaining that balance and neurological health for seniors, and how can they support loved ones at home?
Yeah, so I would say, caregivers like visiting angels that are coming out, or even my clients' caregivers, like their family members, those kind of caregivers, anyone like that surrounding the client. It really helps from my standpoint if they can help with their home exercise program. I typically will have it printed out for them on a piece of paper. I make it really user friendly, but a lot of times I find it's hard for the patient just to do that on their own. So if someone can just go through those exercises with them, just help support them, keep them accountable, that's really going to help keeping their progress outside of their therapy sessions. Another thing I always recommend is just going on walks, keeping active, going out in the community within safe reasons. We don't want them
Right.
walking if it's not recommended, but using their walker properly and keeping them as active as possible outside of therapy is really going to help as well.
Yeah, absolutely. So, you know so much, but how do you feel like you stay ahead in the field of neurological imbalance rehab?
Yeah, so I'm always, trying to take courses and learn new things in the field. I'm always consulting with colleagues and just trying to collaborate with other people to make sure I'm really creating new, creative, fun ways to provide my therapy services. So yeah, I enjoy learning. I try to always kind of stay ahead of the game as far as my different treatment techniques.
Yeah, that's awesome. So, can you share a memorable experience or a success story where a client made, just really great progress through your therapy programs?
Yeah, I have one lady who really comes to mind. She was my first client ever with Fort Mill
Uh,
Neuro Balance. So I started seeing her about 2 years ago now. So I've been seeing her for about 2 years. She was on the younger side. She had a stroke on Christmas Day and discharged from the hospital. She could not even sit up on the edge of the bed without falling over. She was so weak. Needed two people to assist her out of bed. I started seeing her about 4 times a week right away. They really wanted, again, that intensive therapy right off the bat. So I was driving into Charlotte 4 times a week, seeing her. And today she is walking with a cane. She's able to get herself dressed. She's able to cook herself a meal. She's going out on walks with her caregiver down the street. She's going on vacations with her family in her camper. We did a lot of practice going up and down the stairs in her camper. So it's been amazing to see her progress. And now I see her, we've weaned down. I see her just once a month for check-ins just to make sure her exercise program continues to progress as far as working on her balance and some higher level things. But she has been so wonderful, and it's been such a great success story.
must just make give you just warm feeling inside to
It
see the
really does.
progress.
It really does. And she was so motivated, and she's a great client because she works really hard. But yeah, it was pretty cool to see someone not be able to sit up and then, 6 months, a year later, she's walking around. So it's pretty cool.
Yeah, I mean, you give her life back
Yeah.
and, just improve that quality so she can enjoy the time that she has. That's amazing.
Yeah.
So, how can families determine? Obviously, that's an extreme case at the beginning, but what are just some things that they need to look for to know if they could benefit from your services?
Yeah, so I always tell people, research states that everyone begins to lose their balance around the age 40 to 50 years old. So I honestly,
Yikes.
So I honestly believe that everyone can benefit from physical therapy. I think being proactive is really the best way to think about things. Let's not wait for a fall or an injury or a stroke to get us into physical therapy. Let's get started now, get you on a good program to help, maintain your balance and make sure it's not going to get to that point where you're having an injury or a fall. So I would say, if anyone's starting to feel a little bit weak, a little off balance, let's go ahead and just get started, get you on a good program. And then after that, you can kind of continue on a regular basis on your own until, you feel comfortable with it.
Well, I think that's great to say, because
Mm-hmm.
most people, sadly, they are reactive. So
Yeah.
they wait until something has happened. They don't think about the preventative side. I feel like when people hear physical therapy, they think, oh, I've been hurt or I've been injured and now I need physical therapy.
Right.
But people can benefit from that on the other side of it so that they don't have the catastrophic need. Instead, they're just getting themselves in a good physical place so that they're able to be more stable on their feet for longer.
Yes, absolutely. Yeah.
Yeah. So, what are the best ways for seniors, caregivers, their family members, other professionals to connect with you?
Yeah, so the best way, I mean, I'm a solo practice, it's just me, so I'm really easy to connect with. I give everyone my cell phone number, and they can text, all my clients text and call me whenever. So I would love just someone to give me a call. We can chat and just get to know you and kind of see what your needs might be for you or your family member. So yeah, I have my cell phone. I also have a website. It's fortmillneuroimbalance.com. So if you click on there, it's got a lot of good information. You can click and message me on there to schedule an appointment as well.
That's perfect.
Yeah.
Well, thanks for doing this and
You're
squeezing
welcome.
into February for
Yes,
me.
thank you for having me.
Of course, of course.